Welcome, everyone. Thank you so much for joining us today. This is another one of Wellspring's Be Well Talks, and our Be Well series is a webinar series that touches on a variety of different topics related to the experience of cancer. And so today's webinar is on debunking myths about exercise during and after treatment. So we're very excited to have Lindsay Davey here with us today, and I'd love to introduce her before we get started. Lindsay, if I could have the next slide, please. Perfect. So Lindsay has been involved in cancer research and cancer rehabilitation for over 20 years, having started her career as a researcher at Princess Margaret Hospital in radiation oncology, and then as a physiotherapist focusing on the treatment of cancer therapy, side effects, lymphedema, and cancer rehabilitation. She is a clinic director for Toronto Physiotherapy, two physiotherapy clinics that specialize in cancer rehab, where she leads a team of therapists who have advanced training and expertise to help patients with their cancer recovery needs. She also is a regular guest speaker at Toronto Rehabilitation Institute and other cancer support groups, and in the Department of Physical Therapy at the University of Ontario in an oncology scope. So Lindsay, thank you so much for joining us today. I'm happy to pass over the presentation to you.
My pleasure. Thanks for that nice introduction. Hello, everybody from Toronto and beyond. I'm so pleased to be here today to debunk some myths. In my practice, we certainly answer questions like these all the time, and I was thrilled that Wellspring is interested in empowering and informing their membership to allay concerns in a lot of cases. I think my goal is that you'll leave here feeling empowered and informed, and certainly welcome your questions at the end of the talk. And there's a chat that you can enter your questions along the way as well, that we'll try to get to as many as we can at the end. Thank you very much. So we've titled this Debunking the Myths, Exercise During and After Cancer Treatment, and highlighting, of course, the benefits of exercise in debunking those myths. So here we go. Exercise and cancer. So there are many myths that exist about exercise during and after cancer treatment. I think for perspective, there used to be a paradigm of information given out by cancer specialists and physicians and so forth, and physiotherapists even, that really to protect and do less and allow healing to occur on its own during a lot of cancer treatment phases for people. And that is what has, through the research and evidence, been shown to be an older idea. And what we now know is that more is actually quite safe and effective. So a lot of the myths exist with that context of what used to be prescribed and used to be recommended. Individuals may still, though, validly be concerned that exercise will be overwhelming for their body and what they're going through in their cancer journey, either during treatment or after, or counterproductive to what their treatments have been or are at that moment. As I said, extensive research and my personal experience would show that exercising is absolutely safe and can help, in fact, optimize those treatment outcomes that the whole team and individual are so invested in doing. Quality of life scores, of course, off the board as well, in terms of those that exercise during and after cancer treatment. So we're going to dive into this in much more detail here. I want to recognize that there are often barriers to patients feeling they can or are able to or wish to exercise. So just to acknowledge those, they're very real, of course. So if some of these speak to you, you're not alone. Treatment-related fatigue. I will, the next two slides, focus on this particular side effect. It is a very meaningful, very real, very valid symptom experience of cancer patients a lot of the time, and that can be a real barrier for people engaging in exercise. The fear that it will worsen symptoms, we hear that a lot. Lots of uncertainty and disinformation or lack of knowledge about which types of exercise is best, how much, how often, who to seek out that information from. Cancer-specific exercise programs. I can't speak to all the wonderful cities and offerings across the country. I'll speak briefly about what's available in Toronto. Now, many of these programs offer an online version. And so there's lots of ways to have supportive exercise, but lack of knowledge there is a big factor for some people. Certainly emotional and psychological barriers to exercise after cancer, understandably so. Logistical and practical barriers. Again, some online options make some of those barriers a bit easier to move through. And pre-existing levels of inactivity, that's a valid one as well. If you've never been someone that exercises, it can be daunting to feel like you're taking that on during or after cancer treatment. So I just want to acknowledge those. They're real barriers. And hopefully after this talk, you'll feel empowered that there are lots of options as to how to exercise to glean really meaningful benefit. Okay, the most common side effect, I want to touch on this, is this, we call it TRF, treatment-related fatigue. It does affect the vast majority of patients that have gone through a cancer treatment, irrespective of the type of cancer or the type of treatments they're going through when surveyed across large studies. It can last 6 months. It can often last more than that. Some treatment journeys are often longer than 6 months. So of course, this fatigue feature can be at least that long, if not much longer. It is thought to be a significant lack of energy that doesn't get better even with excellent sleeps and sleep hygiene and resting and all of that. It seems to just drag on. Symptoms can include things that go beyond just feeling sleepy, hard to concentrate, difficulty making decisions, whole body muscle aches and joint pains, this kind of thing. Breathlessness, a feeling of anxiety, depression, feeling negative. Stairs or walking may feel daunting when they used to be not a problem. Loss of interest in doing the things previously enjoyed, and then issues with sleeping as well. So there's this fatigue syndrome that can take over in a lot of people going through cancer care. So it's just, again, to validate if that is you and that's been a barrier to exercise, it's real. And I can't wait to tell you about what the treatment for treatment-related fatigue is. And you can probably guess what it is involving exercise, but we'll get to that. So why? I put this one slide in to talk a little bit more about what is it about a cancer treatment experience that causes this fatigue, other than what you might assume, which is you're going to hospital, a lot of hospital visits often, a lot of new pharmaceutical and chemistry treatment agents if you're having chemotherapy or hormone therapy, all those things. But one aspect of what they think causes this particular fatigue syndrome is that a lot of cancer treatments can temporarily, but impact your bone marrow in the sense that your red blood cell production may be a little bit compromised for all the different reasons. The red blood cells, of course, are the ones that carry oxygen throughout the bloodstream and throughout the body. If you don't have as many red blood cells and you're just not getting as much oxygen circulating, even a subtle difference, your heart is very savvy and will compensate. What it will do is beat a little bit faster all the time. Not enough to feel like you're having a racing heart or heart palpitations, nothing like that. But subtly enough, and at 24/7, it's going to try to circulate what it has more quickly. That slightly higher resting heart rate is extremely fatiguing and metabolically taxing, which can go on for weeks and months. So that can lead to this significant fatigue. That's one reason why they think this occurs with lots of different types of cancer care and cancer treatments. So I just put that in there as to why on earth you're trying to sleep a lot, you are taking naps. What is it about cancer care that's making me so tired? There is biological reasons why there's this fatigue syndrome. So that leads into the myth number 1 about cancer and exercise. Rest is best. And this is what I mean about this used to be, and perhaps is still being either spoken overtly or just that's the messaging that you're getting, which is, of course, rest as you need to. And in truth, that's very valid. But for cancer treatment related fatigue, they've studied this in depth, thousands of studies, frankly, internationally. And the most effective treatment is exercise, some form of exercise. We'll talk about the details. This is not intuitive to those who are feeling this overwhelming fatigue, but that's why I want to highlight it as the big message here. If you take nothing else home, it's that even though you feel fatigue, it's the last thing you think that will be productive. It is in fact the most effective treatment to get through that fatigue chapter and out the other side feeling better. Rest is, of course, important. If you're feeling fatigued, you have to rest. There's a balance here, but too much rest can actually worsen the fatigue and lead to muscle loss, muscle wasting, all those other effects, and deconditioning. Mild to moderate exercise can in fact boost energy levels, improve mood, reduce treatment-related side effects across a wide range of side effects. So that is the myth buster on resting is best. What types of exercise and more details on this? They've studied and found that those where you do have an elevated heart rate, a little bit, a challenged heart rate, are best. So that can be walking. That's what's been most studied, but stationary bike, swimming if you're able to, a rebounder, anything where you get that heart rate up. We always recommend to start slow and increase the length of time you're doing it or the intensity when you're able to. Okay, so a slow progression is part of the magic. I always say to patients, it's really important to stop exercising when you're still feeling quite good. If you tip over into just feeling overwhelmed with your endeavor of how far you're going to walk that day or whatever, it's not quite as effective as stopping when you still feel good and even doing the same type of exercise and length of exercise multiple times before you do a little bit more. The goal that has been studied and the research supports, believe it or not just staying at mild intensity, eventually getting to a moderate intensity, which we'll talk about what that is for the heart rate target range, for upwards of 20 to 30 minutes even, 3 to 5 days a week. Maybe surprising to some of you and to some people in the cancer treatment experience. This is the standard advice given in terms of Health Canada's advice on being well and active for adults in general. So they looked to see if there had to be a moderation if someone had been going through a cancer treatment experience, and the research showed no, they will just get even more benefits because of what they're going through cancer. So that is the generalized goal. It means you can start at 10 minutes. It means you can start at 12 minutes. It doesn't mean getting to that 20 or 30 minutes right away. Not at all. And 5 days a week can be an ultimate goal at some point, but starting with 1 day a week, 2 days a week, and 3 days a week is still really supported in the literature. What is moderate intensity? There are lots of different ways to gauge this. Some people say when walking, able to still carry a conversation, that sort of thing. But really to glean the most benefit, getting to that moderate intensity is where the magic is. So a general rule of thumb, if you take your age and you do 220 minus your age and do that calculation, you get a number. Taking 60 to 80% of that number is thought to be a decent gauge of a target heart rate for mild to moderate activity. 80% would be more moderate, as you can imagine, and 60% more mild. Of course, we recommend you speak to your oncologist, family physician, whomever, if you have any reason why raising your heart rate and engaging in elevated heart rate activity is not appropriate for you. Absolutely. But generally speaking, getting to that moderate intensity heart rate range, doing whatever your preferred exercise is with these goals, parameters in mind, is really well studied and supportive for great outcomes. Myth number 2 about cancer and exercise, that exercise has to be high intensity to have benefit. And as I just discussed, in fact, low to moderate intensity exercise absolutely conveys the benefits that are meaningful to someone going through and having been through a cancer treatment experience. So The big ones: reduced fatigue, better sleeps, improved mood, stronger immune function, to name a few. At these low and moderate exercise levels, absolutely those benefits are there and available. So it doesn't have to be that you have to go back to the gym or start a gym program or engage in higher order exercise to glean the benefits. Not the case. There we go. You don't need to push yourself to exhaustion, certainly not exhaustion, to see really meaningful benefit. And that's why that target heart rate is just moderate intensity. Myth number 3 about cancer and exercise. Exercise could interfere with my treatment or my healing journey. This may be a real concern for some patients. And of course, you want to do everything you can do to optimize your treatment effectiveness and your recovery. But the truth of the matter is, tailored exercise programming, it enhances your treatment success rates. That's sort of a known thing now in 2025 cancer care. Whether it's post-surgical recovery, whether it's chemotherapy tolerance, whether it's radiation-related fatigue or the other effects that radiation therapy can cause, immunotherapy, sometimes these long-standing hormone or immune therapy or chemotherapy regimes, they can go on for some years in certain cancer types. And exercise is absolutely associated with better outcomes. It can help the body recover faster, tolerate that drug therapy better, all those things. Lack of exercise, the flip side is it has been correlated with more challenging treatment phases, more complications sometimes. Certainly mood, anxiety, depression, all those things are correlated with people that don't engage in exercise. Slower post-op recovery for sure, the fatigue and drug therapy as mentioned. Myth number 4. I'm too weak to exercise. This is really valid. Whether the cancer itself and all the systemic effects in the body of fighting that cancer carcinogenic process, or the treatment agents that are delivered to you, can really render someone deconditioned, of course, and feeling extremely weak. If that is the case, I would argue that is the most essential presentation of a patient, where we encourage to find something, anything, and there's always something that matches their activity levels and abilities and energy to do exercise. So there can be exercise done in bed or seated. Light resistance training with just even body weight or 1 pound held weights, for example. I often start a lot of my programming with my patients at 1 to 2 pound hand weights or a can of soup, that kind of thing. It doesn't seem like much, but when you're quite deconditioned, even that can raise a heart rate, start the process of muscle building, and really benefit the individual in terms of all those other side effects they're feeling. It doesn't take much a lot of the time. Light exercise, leaving the house, going in the hallway in someone's apartment building and doing some short walks, all of those things. If it's just stretching, a really gentle yoga practice, whatever it is, there's always something that we can find. The key is progressive exercise. So when the patient, not if, when the patient starts to experience those benefits, it's to just dial things up just a little. Length of time they're doing it, the hand weight they're holding, the type of exercise, how long they were able to get into a little bit of an elevated heart rate, some form of challenge to then glean more and more benefit. Myth number 5 about cancer and exercise. Exercise will increase the risk of injury or complications. Naturally, we want to avoid that. We want exercise during and after cancer to always be supportive. And so the best way for me to address this is when guided by a healthcare provider, whether it's in an exercise rehab type program, whether it's you found a physiotherapist to work with, a kinesiologist, or really someone that whoever it may be, it can be modified for everybody so as to avoid any risk of complication or injury, of course. Certainly even those that have more obvious risk factors, let's say, for exercise, we can find modifications that really still enable them to get the benefits that they so need and deserve. That includes bony metastatic disease. Okay, so our stage 4 patients, our palliative patients, they may have tumor sites in their muscles, rather in their bones, organs, whatever the case may be. There are ways to still adopt exercise to accommodate that and really provide meaningful benefit. Blood count, low blood count numbers, modifications can be made. Certainly post-surgical restrictions, of course. Lymphedema risk, part of my practice is lymphedema management. There are absolutely ways to modify, and in fact, a real pillar of treatment of lymphedema and preventing lymphedema is to exercise. Peripheral neuropathy, hands and feet, that can be a factor for people in wanting to go for walks, wanting to pick up weights, whatever the case may be. There are ways to get around that so that we can still get benefit from exercise. And certainly if you're immunocompromised, of course, modifications are important, but possible. Myth number 6 about cancer and exercise. If I've already lost weight or muscle, exercise will only make it worse. The concern there being, if I burn the calories that I'm able to take in, I'm just going to get more deconditioned, more wasted in my muscle and body fat and so forth. And the truth of the matter is, with resistance training specifically, which is a very important part of this whole thing, you can preserve, even if not making gains in muscle mass, you can preserve what you have. And that is so important, not just for enduring the treatment journey that you're in. It also can maintain your functional independence, rising off the toilet, being able to push those doors open, all that independent stuff for people who may be quite deconditioned and have lost a significant amount of weight. I would argue that exercise and resistance training and strength building is essential for those patients. It also improves appetite, nutrient absorption, all those things that make tolerance of drug therapy and so forth so much easier. So stairs, personal care, mobility, balance, these exercises tailored to those patients who have had a tough road calorically or with weight loss is essential. So in theory, you're never too weak to exercise. Again, we can modify bed exercises at the start and progressing from there, all of those things. I don't know why that says myth number 4. I should say myth number 7 if you're keeping count about cancer and exercise. Sorry about that. Exercise is only beneficial for certain cancer types. There's tons of literature on this as well. They've studied this in probably every cancer type. The exercise and cancer literature is really fulsome now in 2025. So I've listed some here, but it can be the blood cancers as well as solid tumor cancer types. Across the board, exercise has been shown to be really meaningfully beneficial. Both the physical and emotional challenges during and after cancer treatment are well addressed by exercise. And oncologists all agree, exercise really is a magic pill. We often say if a medical oncologist could put exercise into pill form or IV form, they most certainly would prescribe it to every patient they are seeing. I want to just touch briefly on a breast cancer study that we published on. I was involved in a study in 2018, and we were interested in cancer and the benefits of exercise for a cancer population. And this was specifically a breast cancer study. They took a breast cancer patient population and sort of piggybacked on the cardiac rehab model. Toronto Rehab is a program that runs all week long to help people after that have had heart disease, heart attack, bypass surgery, and so forth, get reconditioned again with strength training and aerobic exercise. And it happened to be a breast radiation oncologist, I think, many years ago. Given how long the breast cancer journey can be with all the different chapters that are involved in that treatment experience, deconditioning is really prevalent in them. And there's so many benefits in a cardiac rehab model with the same deconditioning. They investigated whether a breast cancer group would glean the same benefits. It's called the Breast Health Program. It still runs. And the breast cancer ladies take over Toronto Rehab at Rumsey in Toronto every Friday. So the cardiac rehab model has enveloped the breast cancer group, and it's a really great program. There's a treadmill because it's a cardiac based, very data driven program. There's a treadmill stress test at the beginning, midpoint, and end. It's a 6-month program. And there's a combination of resistance training and aerobic walking, a progressive walking program, with heart rate targets and so forth, tailored to each individual. And we published on this, it's in the reference list, but all these benefits are known to be correlated between exercise, like those that exercise after cancer treatment. Many of these we were able to illuminate in our study as well. And I'm just putting them up there because it's just so, you can imagine if there was a medicine that was this effective in doing all these wonderful things for patients after cancer care, no matter the cancer type. Even this is a big summary slide for all the benefits of exercise at large in general, but it's really meaningful. And so I hope you leave with the feeling that of excitement to find what's going to be best for you. So it really is the best medicine. This is coming to completion here. Aerobic exercise has been largely studied as the most beneficial way to treat the fatigue symptom that is so prevalent. Stress, depression, better sleeps, all of that. So think, as if nothing else, a progressive walking program really has been studied well to show those benefits. Exercise can increase strength, preserving precious muscle mass, bone density, maintaining independence and function in those that have gone through cancer. Helps maintain appetite, nutrient absorption, really important. And then those all important goals of cancer care, which is decreased cancer recurrence rates. That's a big one. Improved immune responses in those who have exercised after cancer. Faster return to work and activities that may have been put on pause during treatment. Overall quality of life scores absolutely significantly higher among those who have found their way to exercise. A reminder of the goal, in theory, being 20 to 30 minutes, 3 to 5 days a week at that target heart rate range. Certainly, if you progress there, more is okay. If you need guidance, there are people out there in the community that can guide you beyond that. But that is the studied, generally speaking, recommendation. Of course, if you have any questions about your case specific, that's important to address with your team. But I'm excited about that data point because it's nice to see that those that are going through cancer care or after don't have to have a modified best practice in terms of what they can achieve. And this has been studied, every which way to show that that's where the benefits lie. You're allowed to challenge yourself. It only leads to good things. Individualization needed, of course, as needed. A combination of light resistance training and aerobic exercise they found is really a magic combination. So not just the progressive walking or aerobic exercise, but also some resistance training. Wellspring programs are available. Many of you may have accessed these already. There are online versions, in-person classes, depending on your center that's closest to you. The model that is easily accessible would be twice a week for 12 weeks. They're guided by a kinesiologist or physiotherapist trained in cancer rehab. So it's an excellent resource for our cancer care population. They tend to involve a combination of those cardio type exercises where heart rate is elevated in a circuit style with resistance training component as well. There are also, through Wellspring, yoga and Tai Chi and gentle movement programming that is great as an entry point or concurrently with your exercise programming. Really excellent programs. I did go into some detail briefly about that. It happens to be Toronto and it's not offered as a virtual option, but the Toronto Rehab Breast Health Program, it has both the aerobic and strength training with the stress test for data capture, as well as talks that are available from people like myself nutritionist, lots of different people to come in and to complement that program. So if you happen to be in the city and it's a breast cancer treatment experience you've gone through, it's a great program. I don't have to, this isn't about seeing us, but we have some online options as well. I have a video on our cancer rehab page that is my favorite, top 5 early strengthening exercises that's most appropriate for people that have gone through, well, it's not specific to breast cancer. Certainly that's the person that's demonstrating it with me has been a breast cancer patient. She's wearing a lymphedema sleeve, as you'd see in the video. But really, those are just some examples of me going through an exercise routine that covers sort of the whole body in a light exercise sort of model, if that's of interest to check out. And then we also happen to have a rehab science blog that if you have other interests in cancer research, latest topics, common topics we get questions about, we try to keep an active blog about that. So that's a resource that you can use as well as you wish. And I would welcome your questions if there are any. Thank you so much.